A very good day to our beloved lecturer, Dr. Rosli, and my fellow friends in Spadaki 10. Today, our group going to present on topic emerging issue in counseling practice, AADK issues. Okay, let's move on to next slide. Okay, our group member consists of 3 persons. First of all, is myself, Mr. Utaya Kumaranaki Paramasivan. My metric number is 320134. The second member is Mr. Pradip Rashanal Kinararaja, 220134A. The third and last person in our group is Mrs. Rosmawati binti Mokidin, metric number 220135. Okay, in our topic today, we will be cover up into the 5 section. The first is introduction, the second is terminology or definition, the third was emerging issue in counseling, fourth is act applied by ADK, and the last part is conclusion. Okay, for introduction, the role of counselor in drug addiction counseling is provide professional support, education, and confrontation. This is to help the drug addicts mentally healthy. The second is provide its focused role in helping clients so that the client acknowledges and understands that he or she is suffering from billing disease. And third one is encourage and stimulates clients to achieve and maintain a level of drug-free abstinence. Fourth is helping client build a new strategy and more effective problem solving. The fifth is introducing client to support groups such as narcotic anonymous. The last one is encourage client to improve self-concept by practicing coping skill and coping strategy. There are several counseling sessions in ADK. The first is preliminary counseling that called counseling awalan. The second is individual counseling called counseling individu. Third one is group counseling that known as counseling kelompok. The fourth one is family counseling that known as counseling keluarga, which is include the addict's family. The fifth one is reference counseling, known as counseling rujukan. This is occur when another officer refer a case to the counselor. The sixth one is case conference, that is persidangan case. The seventh is consultation case, case konsultasi. The last one is client rehabilitation plan, which is known as rancangan pemulihan klien RPK. Okay, next is a terminology or definition. Okay, in ADK, there was a rehabilitation officer. Rehabilitation officer referred to officer appointed under Section 2 of the Drug Addicts Treatment and Rehabilitation Act 1983 and Section 5 bracket 1 of the National Anti-Drug Agency Act 2004. The second one is counselor. Counselor refers to a person who is registered and has a practicing certificate with the Malaysian Board of Counselor. The third one is client. Client referred to a supervised person or OKP who is undergoing a treatment and rehabilitation program in the community. Okay, for the next section, I would invite my friends.
Thank you, Mr. Utaya. Assalamualaikum warahmatullahi wabarakatuh, and good afternoon to Dr. Rosli and to all my friends. My name is Rosmawati binti Muhyiddin. Today, I want to continue my group presentation. So, this is Act applied by AADK. In AADK, we use Akta 283, Akta Penagih Dadah, Rawatan dan Pemulihan 1983, Amendment 1998. To that end, the Act was created to maintain ethics between officer and client as well as ensure the law is complied with. In Section 20, 1A, B, C, and D relate offences by detainees in rehabilitation center and advanced personal care center and person undergoing supervision, or we call orang kena pengawasan. If the client commit an offence and if convicted may be fined or imprisoned for a term not exceeding 3 years or both. Punishment will be imposed on them. Duties and responsibilities of rehabilitation officer. Rehabilitation officer refer to subsection 2. 1. Supervision of all related matter with the arrest, treatment and rehabilitation of drug addict below this act, and shall be appointed a number of rehabilitation officer required from time to time for the purpose of this act. And the next, police officer or rehabilitation officer have the power to detain suspected drug addict under section 3 of the Drug Addict Treatment and Rehabilitation Act 1983, Amendment 1998. Agency officer have power equivalent to police officer with the rank of Inspector of Royal Malaysia Police. This is an informed consent form, or we call borang persetujuan termaklum. This form requires a signature by the client and counsellor before begin the counselling session. The purpose is to ensure that the ethic of confidentiality can be adhered to and to pass information to others if there is something illegal. Those involved in drug addiction are linked to legal misconduct such as attempted robbery, rape, and so on. This form is very important and can be advanced in court. Okay, these are emerging issue in counseling AADK. We go to first point, limitation of expertise. Client in dual diagnosis category require an integrated rehabilitation plan involving psychiatric consultation. Counselor do not have the necessary skill and professionalism to handle such case. Referral to a psychiatrist had to be done to treat the psychiatric problem experienced by the client before engaging the client with his or her psychosocial recovery program. The issue becomes more difficult when the client does not want to be referred to a psychiatrist. Client facing psychiatric issue in addition to billing drug is a difficult problem and challenge to deal with counselor. Now, AADK has a special rehabilitation center for dual diagnosis at Tampoi Rehabilitation Center in Johor. So, any client who have a dual diagnosis of symptoms should undergo treatment and rehabilitation there. There is treatment expertise from both angel. AADK and Tampoi Hospital have a collaboration to address this dual diagnosis problem. These constraints of expertise occur when the client is in community supervision, district AADK. Counseling is a key element and tools in drug addiction rehabilitation. The needs for professional training to this service providers to ensure more service quality and effective. Okay, the second point is no supervisory system and systematic monitoring of the quality and standard of counseling. In AADK, counseling is a main topic to be researched and refined. This is in line with the Will a Counselor Code of Ethics that determines the quality of service counselor are enhanced and improved through supervisory method and continuous monitoring. The system will also ensure a more appropriate diagnosis and intervention process and effectively can be carried out, which of course will be able to avoid from the occurrence of diagnosis and inappropriate therapy. So far, no specific monitoring has been done at Aadk to rehabilitation officer who conduct counselling session, such as the board of counselor, which require CPD point for the evaluation of a counselor performance. And the third point is the client's dependence on the counselor. Strong social support, typical of those who are important in the life of such client, family member, non-addicted peer, employers, and so on. The lack of social support will make it difficult for client to the problem of resuming his affected social relationship, and in turn can trying each individual to achieve recovery. The boundaries of the counselor and client relationship are mistaken for causing the client to depend on the counselor. The client is so dependent on the counselor that he cannot stand on his own to solve his problem. Okay, and the fourth point is workload and responsibilities more than is supposed. Counselor not only have to deal with the number of many cases exceed the specific ratio, but also burden with a variety of additional tasks that sometimes loses his focus to carry out his essential duties. Effort to help the client cannot run perfectly and effectively if it continues. Counselor or rehabilitation officer have various branch of duties. Example, treatment and rehabilitation in unit rehabilitation officer. Uh, Second, enforcement unit as a enforcement officer. And third is prevention unit as a prevention officer. Rehabilitation officer cannot concentrate on the counselling session alone, having to complete other tasks related to prevention and arrest. There is no specialization of tasks. This causes counselling session to sometimes fail to run as they should. And next, I will pass to next presenter, Mr. Pradeep. Thank you from me.
Thank you, Pon Rosma, for your presentation. Next, I'm going to present about emerging issue in AADK facilities during the counseling session. Counselor and client's relationship are not professional. What I mean is the frequency of counseling session with the particular client causes the client's dependency on the counselor to the point of emotional connection. Eventually, they pursue into a romantic relationship which impair counselor's professional performance and also ethical conflict of interest. This followed by the emotional dependency can occur when counselor dwells too deep into personal problems and emotion of a client without barrier from beginning. Maksud dalam ni, setiap klien di pusat serenti atau puspen, dia akan ada seorang kaunselor. So apabila ada sesi, klien selalunya
akan cuba, contohlah kaunselor tu cantik ke, dia akan mengayak lah, cuba mengayak kaunselor tu. Dan selalunya contoh klien akan ada cerita-cerita dia sendiri. Let's say klien ni dah pernah berkahwin, sekarang dah cerai. So dia akan cerita tentang bekas isteri dia dengan kisah-kisah cinta dia dulu. Sometimes kaunselor ni akan terlalu deep into cerita dia sampai tercetusnya relationship yang romantis. So sampai yang kaunselor kahwin dengan klien pun ada. That's what we mean as counselor and client relationship are not professional. Next will be dispute between counselor and client's family members. The frequency of counseling session with the particular client causes the family members, especially the client's wife, have a very bad impressions towards the counselor. Next will be the client's wife will come to a conclusion that the counselor is having affair with her husband in the name of counseling session, which affect the recovery process of the client. Macam saya kata tadi, dalam Puspen, setiap klien akan ada seseorang kaunselor. So selalunya kaunselor perempuan. So apabila klien ni akan ada banyak kali sesi dengan kaunselor tu, memang ikut SOP memang kena banyak kali lah dia punya sesi. So klien ni akan 2 kali seminggu akan ada perjumpaan dengan keluarga. Selalunya yang datang tu wife lah, other than parents, wife yang akan datang. So apabila klien jumpa dengan wife ni, terlalu banyak kali klien ni akan mention nama kaunselor dia. So dia akan mention nama kaunselor, kaunselor bagi ni, bagi tu, mengadakan sesi ni, sesi ni. Benda tu akan mendatangkan cemburu dengan perasaan syak yang kaunselor dengan klien ni macam ada hubungan sulit. So perasaan cemburu tu akan tercetus daripada wife. Dan apabila kaunselor ni nak berhubung dengan wife tentang progres suami dia, wife akan macam maki-maki, marah-marah kaunselor, dan dia akan terus isu tu atau klien akan terus ke pihak atasan lah. Selalunya kaunselor akan buat laporan dan pihak atasan akan mungkin tukar ke kaunselor lain ataupun mengadakan sesi kaunseling untuk wife dia pula. Dia akan panggil wife dia, kita akan bincang, kita akan menjelaskan tentang apa tu sesi kaunseling, apa motif seseorang kaunselor untuk mengadakan banyak kali sesi dengan klien tu. So sometimes family members atau wife ni akan faham, some of the family members dengan wife ni akan masih takkan faham. That's what we mean by dispute between counselor and client's family members. The next issue we're going to look about gender differences between clients and counselors. Female counselor versus male client occurs limitation to sharing problem during counseling session due to gender. Basically in Aadk, majority clients are male and majority counselors are female. Oleh itu macam di fasiliti Aadk daerah atau di pusat serenti, klien majoritinya lelaki lah, dan macam saya kata kaunselor semua perempuan. So apabila ada sesi kaunseling ni, klien macam teragak-agak nak share dia punya problem. Contohnya macam klien tu ada penyakit HIV ke, macam tu. Bila kaunselor tanya lebih mendalam lagi macam mana dia boleh dapat penyakit tu, klien akan macam teragak-agak kerana jantina berlainan. Apabila kaunselor ni perempuan, dia memang ada macam halangan untuk dia share dia punya problem dengan lebih detail. So itu yang dimaksudkan dengan gender differences between clients and counselors. The last one will be differences in educational standard between counselor and clients. Conflict occurs when clients presume that they are more qualified in education than the counselor. Counselor will be having difficulty in establishing a ground for comfortable counseling session as the client denies or refuses to cooperate. Maksud saya ni, dalam setiap sesi kaunseling ni, contohnya ada yang klien yang berpendidikan, kelayakan pendidikannya tinggi daripada kaunselor, dan ego tu akan menghalang klien tu untuk share sebarang problem dia, masalah dia. Apabila kaunselor tanya apa pun, dia rasa macam dia lebih tahu, rasa dia qualify. Macam contoh di puspen saya yang bertugas ni, dulu kami ada seorang klien ni, dia adalah pensyarah universiti kerajaan. Apabila dia berjumpa dengan kaunselor ni, dia memang tak bagi kerjasama. Dia memang tak bagi kerjasama. Tanya apa pun, dia mesti jawapan dia tak kena mengena dengan pertanyaan seorang kaunselor. So ego dia agak tinggi terhadap kelayakan pendidikan, sehingga klien tu dibawa ke pihak atasan dan pengarah kami yang jadi kaunselor dia. So baru dia boleh macam bagi kerjasama sikit, then after that dia bolehlah ikut kaunselor dan akhirnya dia pun berjaya dah masuk balik kerja. As a conclusion, rehabilitation officers need to be assessed on the level of competency and skills of counselling to ensure that the counselling session conducted are effective and achieve their objective. This followed by professional level training should be implemented specifically for all Aadk rehabilitation officers to ensure that the level of expertise related to drug rehabilitation counselling is equivalent to the registered counsellors. During the counselling service carried out at the centre, ethical aspects should be emphasized so that there will be no ethical violation. The central management should specialize the scope of work does not burden the staff who carried out counselling service with other fields of work. This will affect the quality of counselling service. Bermaksud pegawai pemulihan perlu dinilai tahap kecekapan dia dengan kemahiran kaunseling untuk memastikan sesi kaunseling yang dijalankan berkesan dan mencapai objektifnya. So itu saja daripada grup kami. Kalau ada apa-apa soalan, sila tanya selepas ni, dan saya ucapkan terima kasih kepada all my group members, Dr. Rosli dengan all my classmates for your cooperation. Thank you so much. Once again, thank you from us.